Over the past year, North Lincolnshire CCG has been making improvements to your local NHS. Online consultations are now available at some of our practices. We also made general practice appointments available on evenings and at weekends.
Young people nowadays are more technical. We're always on our phones, we like that type of stuff, it's easy and it's quick. It's also more like, I'd say private, because then I don't have to speak over the phone about my healthcare problems in front of other people in college, if I need to ring them in college or at work and all the rest of it. Like I just can do it online where only I know what I'm writing, but it's much more time efficient. Or we're at college all of the time or at work all of the time, so it'd be easier and more quicker just writing a form and they get back to us. I never knew that you could get appointments on a Sunday, so that'd be absolutely amazing. It'd be so beneficial to young people like me.
Healthcare professionals in the community, hospice and out-of-hours services can see up-to-date information about their patients in real time.
Recently, I had a 91-year-old lady referred to myself. When I went to go and visit her at her home, she was very, very confused about all the medication she was on. She had medications everywhere basically and didn't know which one she should be taking and which one she shouldn't. So the new way of working enabled me to look at her GP records, which allowed me to look at her current medication, and I could work through that with her and get rid of the things she didn't need and ensure she had everything that she did need and that she knew how to take it properly.
We spoke to the public about plans to build a new urgent treatment centre in Scunthorpe.
There were over 1,000 people responded to our survey, and we wanted to also ensure that those people who we don't normally engage with could respond as well. So we went out to speak to people in the community throughout January. People were saying that they want to be able to see the right clinician straight away when they have an urgent care need, and this is really important to them. So having an urgent treatment centre based at Scunthorpe General Hospital will best meet their needs.
The Urgent Treatment Centre is a new facility, brand new built here at Scunthorpe Hospital, and the idea is that patients that are coming in that are less acutely ill will be seen in probably a more timely manner by either a GP or a nurse practitioner, and that will also relieve some of the pressures that we have in A&E.
There's a new frailty service to help keep the elderly safe and well.
The frailty service is a service that's been commissioned by the CCG, specifically to look at patients over the age of 65 who have multiple problems, and we go out and do a holistic assessment, what we call a comprehensive geriatric assessment, that looks at all aspects of their health care to try and prevent further falls and also to try and improve their quality of life.
People are getting help sooner. Practice receptionists have been trained to help guide patients to the most appropriate healthcare service for their needs.
We ask you questions so that we make sure that we're getting you seen by the correct person or people when they come to the practice. The message from the doctor is, please tell our receptionist so that we can point you in the right direction.
You can now book an appointment with an NHS physiotherapist without needing to see a GP first.
Patients can come to see a physio directly with their musculoskeletal problem rather than going to see their GP. So obviously physios are ideally placed to assess musculoskeletal and treat musculoskeletal conditions because that's what we're trained in. You know, our job is understanding the mechanics and how your musculoskeletal system works. So we're the ideal person to come and see if you've got a bad back or a bad knee or a bad foot or you know, a particular pain issue or a mobility problem.
After suffering from pain in my lower back on the right hand side, I rang the doctors, and the girl who answered the phone actually suggested that it might be better to go for physiotherapy, interview or assessment, and that is exactly what happened.
For more information about your local NHS, visit northlincolnshireccg.nhs.net.